This video shows some of the key features we see in the clinic in runners with anterior knee pain or lateral knee pain or even outer hip pain. As this runner comes through and comes into contact with the ground, we get a good view of the position of her right foot. We can see the inside border of her foot and her big toe, but not the outside border. Her foot is turned inwards or internally rotated. In addition, the knees are almost knocking together, so an inswing of the knees. Both these are indicative of an internally rotated leg, starting from the hip. At the point of mid-stance, when the body is aiming to control the downward pressure of gravity, this runner demonstrates a failure to control lumbopelvic positioning. Her pelvis drops down to the left, her knee swings inwards. You can see a bunching and a shortening of her right waistline. This position is a key finding when the gluteal muscles are inefficient, failing to control load transfer, failing to maintain alignment of the system. The consequence for injury is, there are many. In a runner with anterior knee pain, we see the drop of the pelvis pushes this outer hip out and places tension on the iliotibial band right down to the knee. This places a greater compressive force on the lateral aspect of the kneecap, and anterior knee pain can be the consequence. In addition, this tensioned iliotibial band can also be the cause of runner's knee. So you can see that two really common knee injuries in runners can easily be coming from the hip, from both an internally rotated hip and the inefficiency of the gluteal system. A third injury that is common in this group is back pain. And you could see from this runner that the drop of the pelvis and the bunching of the hip is basically causing the lumbar spine to be in quite a degree of side flexion, causing compression on the right side structures and strain on the left. In the video analysis, once these features have been pinpointed, treatment can really focus at the cause of the injury, which in this case is the efficiency and control of the gluteal muscles and the core. If we get to work on retraining, position of the limb, activation of the glutes and strength around the gluteal muscles, then the injury will resolve and running will become a pleasure again.